and Chitra from GEM. And this is Arthur Allen.
So I know about as much about blockchain as probably the person in here who knows the least about it.
Your mic.
And I don't even get a mic. Oh, I already have one. So I don't get two, which is kind of a gibble. So I'm going to start asking some really basic questions to Chitra, who knows how to ask questions better than I do, but we'll let her answer in this case. So Chitra, what makes blockchain better than current systems at getting around problems with patient consent, identification, privacy, and some of the other issues that have snarled, interoperability or, the exchange of care and coordination of care in the healthcare system?
Well, the decentralized nature of blockchain is what makes it such a powerful tool, because it allows the enforcement of privacy rules while allowing different parties in a healthcare system to actually share and explore data depending on the permissions that they're given to see that aspect of the data depending on their roles, whether they're a doctor or they're a pharmacy or an insurance company. And so, for instance, at GEM, what we do is we create unique patient identifiers, a unique global identity for a patient. You can attach all of the patient's data to that identifier. You register the location of that data. You don't store the data on the blockchain. You register that data on the blockchain with all of the access control policies registered on it as well, so that everybody in the blockchain can then be connected through the patient's unique identifier. So you can actually follow a patient through a patient's medical journey, whether you're the doctor, you're a pharmacy, or you are an insurance company. And
blockchain assigns you a unique identifier, because we don't have those in our...
That's right. So the process of processing this data, we would assign a unique identifier on the blockchain for that patient. And just to give you a very, very simple example, I'm new to GEM and new to the whole blockchain world. And so all of this was really theoretical for me until last week, when my father, 87 years old, a cardiac bypass patient with diabetes and blood pressure, visited us and became terribly ill, ended up in the hospital, in the emergency room with severe anemia, and we didn't know what was going on. And we had potentially a single point of failure, and that was a list of his medications, 10 very complex medications, all of which had side effects. But because they were from India, all of the brand names were Indian, and so we had to convert them at the hospital pharmacy into generic names, but the pharmacy got one of the medications wrong, and so all of the doctors thought he was on 2 blood thinners instead of 1 blood thinner. And every time a specialist came into the room, we had to explain to him. We became the translators of our father's health information, and this could have been potentially catastrophic. Had there been and that was the first time I realized what a blockchain could really do, because all of this data could have been registered on a blockchain so that every person who walked into that room would have had access to that information based on their permissions. And perhaps, in this case, we were lucky he survived, but it could have turned out to be very, very different.
I think everyone has a story now that's with one or another of the problems with information flow in healthcare and confusion and the problems it can lead to. Lisa, I was wondering if you could explain to us, where does blockchain live? I mean, and how do if I'm a doctor or a patient, how am I going to access it? I mean, how ready is it for prime time? How far down the line is it before people are going to be talking about it in healthcare settings?
I think it's important to understand that blockchain is comprised of a lot of technologies that have been around a long time. So not all of this is new. Some people are doing new things with it. There are a lot of people already do identity who anticipate having a role in how some of these services take place in the blockchain. But more often than not, it will exist in the cloud. Microsoft certainly has a point of view on that, so do other cloud providers. The physicians, the insurance companies, the pharmacies, the other stakeholders that increasingly, and this is part of what is interesting, and you just touched on it, a distributed network allows other participants, non-typical participants in a consumer or patient's episode of care to start to participate in that value chain. So now an insurance company, a life insurance company, or a bank who wants to offer financing to that patient as they're showing up for their procedure can now participate.
But so the patient has to invite the bank in.
Or this is the way it could happen. The patient goes to their typical healthcare site to schedule an appointment. Now, and even you can do this today with PocketDoc, you don't have to wait for a blockchain. You can check their eligibility, their deductible, what they've satisfied in real time. I know whether or not they owe something on their bill up front. I can ask them if they would like to to have a payment option. All of that can happen today. Part of what we should talk about today is what's necessary. What is blockchain? What does it uniquely enable versus what can already be done without blockchain? But it exists in the cloud. You'll encounter it as a consumer like you do everything else. And as a provider, you will as well. You don't even have to know it's blockchain.
Hector, I was wondering if Microsoft is a largish company. What's the business case for you to be involved in the healthcare area, or are you just along for the ride today?
Yeah, it's a long ride. It's a bit of a journey, but it's everything that's being talked about. I think you nailed it with your answer, and I want everyone to really take this back with whatever they do, if it's healthcare or not. But it begins with identity, and in healthcare we have multiple identities. We're not always patients, but our identity as patients is absolutely critical, and we've got to be able to attach everything we do to our identity. And with the hyperscale cloud, it makes this distributed ledger, this interoperable identity, much easier to do. So the concept of doing this with old technologies is going to be hard. And you have to say, we've got to stop that. Healthcare has already done that. We no longer live in that world of infectious disease where we could solve those problems with old technology. We live in a world of chronic disease where it's taking big data, it's taking data-driven capabilities, secure data interoperability to solve those types of problems, even what PocketDoc is doing. And I can see the integration of these applications to the blockchain with either on-chain or off-chain data to make the patient experience much easier, the ability to access care, to afford it, to drive better outcomes, because that's really what healthcare is all about. It's not about technology, it's about what we call the triple aim. But it brings all of these things together. And Microsoft's role is an enabler. It was said earlier when Debbie was talking, Perry Ann, and it's the role that technology plays can be absolutely massive as an enabler. And we've got to listen to the industry and do what they need us to do.
Avi,
Hey, how are
you're
you?
going to be the...
Sorry I was a few minutes late.
That's okay. Thanks for coming. So there's starting to be a bit of a stir on the Hill. I don't know
That's where I just came from.
how genuine it is, but there must be contributions in the offing or something that's gotten them interested. Now, maybe they're deeply interested in it. What are the policy questions in healthcare?
Yeah.
Are you already thinking in terms of, do you know enough about blockchain and where it's going to feel that there's going to be needs for some regulatory or legislative changes to enable it to happen, or is it just one of the many technological things that you are, tracking and?
More the former, but so let me talk about, there's basically two categories of policy which are going to affect the adoption of blockchain in healthcare. And there is a lot of interest, not just from the people in this room, but outside of it, in the applications of blockchain. I look at there with Bruce Broussard. Some of you, if you follow this stuff closely, Bruce Broussard, who's the CEO of Humana, actually put an op-ed out on his LinkedIn page talking about the applications of blockchain with patient records and transmission of data. But broadly speaking, let me talk about these two policy categories. The first category is what we call in the business data liquidity, the barriers to the smooth transfer of patient information from patient to doctor to hospital to insurance company and everything in between. And that's governed by two laws in particular. A law called HIPAA, which is the Health Insurance Portability and Privacy Act, I think is the abbreviation, and portability,
Accountability.
accountability. Okay, it's one P and two A's, and the Stark law and some anti-kickback laws that basically prevent IT companies from deriving any economic value from making the transfer of information more efficient between patients and healthcare service providers. So those two sets of laws and the thousands of pages of regulations, tens of thousands of pages of regulations that surround those laws has been a real barrier to the adoption of IT in general, in terms of, that's why your doctor still has a piece of paper rather than, that's why there was another law that had to be passed to say, let's have electronic health records. And in theory, that law, the HITECH Act of 2009, is supposed to address some of this by creating the platforms of interoperability that will allow more data liquidity over time. We'll see how successful they are. There's been a lot of slowdown in getting that through. So there are, and health reform today isn't directly addressing that panoply of issues, that category. But I think that we will see, as health reform advances, what the House and Congress are talking about is a three-stage process. Stage 3 and also Stage 2, where HHS and CMS, the U.S. Department of Health and Human Services, and the Centers for Medicare and Medicaid Services, provide some regulatory flexibility that will allow more efficient transfer of information. That's Category 1. Category 2 is actually what is in the news every day, the Obamacare repeal and replace stuff. And there I will make one key point, which is that if Republicans are successful at passing what they want to pass, which is highly uncertain at this point, but if they do, it's actually going to free up a lot of opportunity for innovation in the delivery and transmission of healthcare information. The reason is that basically where we're seeing in general, digital health entrepreneurs and technology innovation developing is in the segment of healthcare where patients are controlling the dollars. So it's either health savings account money, or it's your out-of-pocket deductibles and copays. How to actually take those dollars and spend them is where digital health is having the most uptake, because consumers want that information and that cost and that spend to be done in a more efficient way. The stuff that's done through the government and through insurance companies, through third parties, is a lot more bureaucratic and a lot more regulated. So if Republicans are successful at converting the ACA, the Affordable Care Act, into tax credits where people can actually say, you know what, I'm going to buy health insurance with some portion of that, and then maybe some portion of that goes in a health savings account, that's more out-of-pocket dollars that digital health entrepreneurs will be able to take advantage of to provide services that patients really want, including things that relate to blockchain.
Okay, well, we'll get back to that. Thank you. Debbie, I wanted to ask you if blockchain is a viable system, what impact does it have on the existing EHR, or health IT ecosystem? So we've spent the last 7 years working on, with meaningful use and various ways of requirements for health IT. And there are also a lot of, private initiatives like the Commonwealth Alliance and so on that are working on interoperability. Do you foresee how blockchain fits into all of this? Does it just, if it works and it's fabulous, does it just make everything else go away, or does it require, some kind of melding, or is it many flowers blooming, or sort of how does it fit?
So, so there's been proponents who
I'm
suggest.
picking on you because you're ONC. So
Yeah, I know you waited till last. I know. So there've been some proponents about tear and replace, and from my understanding of, and I noticed I said my understanding of blockchain, it's more ubiquitous. It's often compared to the internet, and that if blockchain itself is successful, I think we will see products and services just adopt it. That there would need to be legislation to use it doesn't seem likely, at least to me, for that type of thing. I think as ONC is keeping a watch on industry to see where it's going, I think it's way too early. There are way too many flavors to really predict about where it would go. So I think it's really way too early to even say something like that.
Well, let me just get a quick round from you guys. How long are we talking about before this could become a significant part of healthcare, blockchain?
PocketDocs brought together an alliance of industry stakeholders, your largest health systems, health insurers, tech companies, vendors, to help us identify the top 3 use cases that will go into production this year. So that is identity, that is autonomous auto adjudication of claims, and supply chain. So whether or not, it was bold to say we'll get all 3 into production this year, but will we get 1, and will it be used according to current regulation and standards, which all apply? Yes, it will.
Is that difficult, the regulatory part, adjusting to?
No, I mean, we already had to solve it for what we do today with APIs. We connect to over 500 insurance companies with BAAs with each of them. We are HIPAA compliant. We have the highest clearinghouse certification available. We're the only one who has level 4. So we've covered that territory already. And it still applies to every transaction that we do on the blockchain.
Chitra, I was wondering, what's your view, and maybe you can explain this, and this has to do with how long it takes to implement this. If I am a patient in Partners, and Partners, being ahead of the game on a lot of things, maybe not everything, but they start using blockchain and their patients. Their doctors are all using it and passing along, but still I'm a patient and some of my doctors are with another system in the Boston area. How much buy-in does there have to be? I mean, there's this whole question of, with all computer systems, the garbage in, garbage out. So if we're building this ledger that's supposed to have all of my information on it and stuff is missing, how useful is that ledger going to be?
Yeah, I mean, you're only as good as the data that governs your history, your personal history. But I think what blockchain allows you to do for probably the first time is to be able to start to break down some of those data silos between organizations so that people can start to have this fluidity that Avik was talking about in data sharing, to be able to explore data from different perspectives. I think that it's not a silver bullet. It's not going to be a panacea for all of our ills in what's raising costs sky high in the healthcare system today. But there are certain things that blockchains can do. As you mentioned, supply chain, looking at provenance of medical devices, looking at revenue cycle management, and adding that on top of a longitudinal health record. The things that play on the characteristics of blockchain, that which makes it so powerful, are the things I think that we can start to phase in a little by little. And I think we're about a couple of years away before we actually start to see this widespread buy-in kind of data sharing in mass quantities across organizations. The way we like to say it is 2016 was the year of pilots, where we were starting to test out some of these concepts and these methods of trying to share data across blockchains with healthcare data. 2017, this year, we're moving to larger proofs of concepts with data silos within an organization, maybe smaller data sharing across organizations. And then you're going to see in the next 2 years some of these larger kind of enterprise data sharing efforts across organizations. But one of the biggest problems is not going to be with the technology itself. It's going to be how we connect that technology, which is foundational and transformational in many ways, to all of these legacy systems that have been built over the past 10 or 15 years. And so one way to look at it is to start to build some of these partnerships with organizations that have those plug-ins into the existing legacy systems. And so, we're kind of building the plumbing before we start to even think about building the house. What you're looking at is really not a big data problem. It's a big data sharing problem. And so you got to approach it in a different way. You don't really need a big data solution. What you need is, how do you start building these pipes? And the way to do that is, you look at what the use case is, you look at what your partners, who the partners are, who are the stakeholders, what are you trying to accomplish? And then you start to build that networks rather than trying to do it the other way around, building the networks and then trying to find the problem.
Yeah, and I think the reason why Chitra and I are laughing is she knows we've built the pipes. We started with the pipes as opposed to moving direct to the blockchain.
So as you build the pipes, to say it with that analogy, is your pipes going to fit your pipes? Or is there
Are they
going to be
interoperable pipes?
interoperability
Yeah.
between these different solutions?
Our pipes
that
are
being
open. Yeah,
But
pipes are open.
You're-
Interoperability is a
They-
huge,
so I
You
think
have
that's
open
a.
source.
They're open APIs. Anyone can access them.
I think what's really important,
Yeah.
though, to add to what Chicha is talking about, and again, if you're going to work in healthcare, look at the standards. Look at what the Fast Health interoperability resources are doing. It's called HL7 Fire. It's all about interoperability. So blockchain is a game-changing technology. It is not a solution. And earlier this year, last month in February, at the HIMSS conference, we spoke about 3 forces in healthcare: digital transformation, cybersecurity, and interoperability. No one was talking about blockchain this year. Next year, I can guarantee you everybody's going to be talking about blockchain. You know, I meet with Bruce and a lot of the leaders in healthcare. I talk about it. It's part of my job at Microsoft. Everybody that I meet with in health plans and providers is saying, we're interested in blockchain. We don't know yet what to do with it. That's why this Connectathon that went on yesterday and today was so important, because these are really good examples. They're use cases. I mean, I get that question all the time. What use cases are we going to enable? So we need that to come forward. We need what you guys are doing with vendors like Microsoft, IBM, to do that. But you know, I got to repeat what you said. It must be interoperable. Working in the dark, building kind of intranet type things, we had that problem. We don't need more of that.
And
Avik,
just
could I-
going back to what Avik said about what's the priority on the Hill today, and your question, you know, is Congress going to deal with it? I think even if they don't deal with it directly, they're trying to wrestle this huge beast to the ground, which is how do we reduce our healthcare costs?
Yep.
And the number 2, the top 2 reasons, the number 2 reason why healthcare costs are skyrocketing is data processing inefficiencies. And it is the numbers are simply staggering. I pulled some numbers. 3 in 10 test results are reordered because people can't find the tests. 30% of the time, patient shows up at a doctor's office, his file is missing. There are 15 billion transactions every year on the fax machine. Most of us don't even know anymore what a fax machine is. Every provider files 20,000 forms each year. Just imagine the amount of time it takes to do something like that. And if you look at our healthcare costs, you know, it's $3 trillion, $10,000 a patient, going up to more than $5 trillion, going up 5.8% every year.
Okay.
86% of medical errors are caused by data
These
errors.
aren't blockchain problems.
Yeah.
Yeah, I just want to be clear. These are business model
Well,
problems.
Yeah.
Well,
So,
that's
yeah, let's be
something I
clear
wanted
about
to
that.
ask Avik about,
Yeah.
but first I'm going to go. Debbie had something to say. Didn't you?
no, well, what I started to say was, even in the Codathon, I think 2 of the themes that came out was education and interoperability. So even with these groups that are really focused on blockchain, there is an acknowledgement that in healthcare to be a real education on how it can be used, and then an education among these different teams and among the technologies so that there could be better coordination, and again, around the interoperability, I think is very key.
I had a question about regulation, Avik, in this regard. It seems to me we've been covering sort of the 21st Century Cures bill pretty closely, and also hearing, you know, we listen very closely to sources who are either lobbyists or campaigning for patients and so on. And there's sort of a contradiction, I think, in some of what we hear kind of from the conservative side, which is, on the one hand, the 21st Century Cures bill, which is pretty much a conservative, written pretty much by
It was a
Republicans.
bipartisan.
It was bipartisan,
bill.
but I think it was, anyway, it had the support of Republicans who were involved. And there it's really calling for a heavier hand on the part of ONC or HHS really to police interoperability. And on the other hand, you have there are people who want to do away with ONC altogether, or give everything its powers to FDA, and then it seems like the new FDA commissioner wants to give FDA's some of its powers to ONC. I guess the question, since this is a relevant issue now with the new administration kind of getting its feel for power and what its agenda is going to be, what's your take on this? Is this an area where, like, laissez-faire is the best way to go in the future and get rid of the clutter that exists, or do we need certain principles of regulatory or legal principles, put them in place and enforce them, with some might?
Well, if there's one thing healthcare has plenty of, it's regulation. There is no absence of regulation in healthcare. Listening to the panelists and actually talk about, well, where are all these healthcare costs coming from, and how do we, have more adoption of innovative technologies? The thing to understand about healthcare, why is it? Why is it that we use paper? Why is it that there are all these errors and things? It's because of a fundamental problem with our healthcare system that's been true for at least 70 years. And that is, of the people who actually have health insurance in this country, which is about 90% now, 90% of them didn't even shop for their own insurance plan. They got it from their employer. Probably most of the people in this room get insurance for their employer or from the government through Medicare or Medicaid or some other government program, which means that you're not paying for that, buying for that service yourself. We always say, why isn't there an Uber of healthcare? Well, when you go call up an Uber, you're paying for that Uber through your own credit card, right? Generally speaking, with healthcare, you have an insurance company paying for it on your behalf. And actually, you're not even shopping for the insurance plan yourself. Somebody else has picked that out. Some HR person has picked that out for you, or the government, and is choosing your insurance. And the cost of the insurance plan is being taken out of your paycheck before you even see it. So that's why we don't have a consumer-oriented healthcare system. And it's consumers, particularly consumers at the low end of the income scale, who are the ones who typically demand more innovation. And the reason why there's technological innovation delivery of services across the economy is because lower cost consumers who are price sensitive demand it. And that's less true in healthcare because we've taken the consumer out of that role that the consumer has and the patient has in the rest of the economy. So that's why I hearken back to this important...
But the lower income people are the people who tend to not have insurance through employers.
But they do through the government often, through Medicaid and other programs, right? So the effort at reform, if it works the right way, and again, there are lots of things and I've written a lot of things that are critical about what Republicans are doing in Congress, but there are some key constructive elements. And one of the keys is, if you take the dollars, we spend a lot of money in America, about $1.5 trillion a year, depending on how you count it, subsidizing health coverage for people, rich and poor. And probably, there's ways we need to rebalance that. But if you take those dollars and give patients more control of those dollars, patients will demand more liquidity of their patient data. They'll demand that they own their own patient records. They'll demand that technologies like blockchain be adopted so that their patient records can be deployed and delivered efficiently to the multiple providers they're using, whether it's nursing homes,
Where's
cardiologists.
the evidence for that'll happen?
The evidence for that is the rest of the economy. Right? So if you make healthcare look a little bit more like the rest of the economy, the room for innovation is tremendous. And we see it actually, as I said, in healthcare, where the part of the healthcare economy that consumers control is where there's by far, by like a country mile, the most innovation in terms of the delivery of healthcare services and the uptake of technology.
Give me some examples of that. I wanted to get back to that. You had mentioned it in your earlier.
Yeah, so if you look at the level, South by Southwest is going on in my hometown of Austin right now. I'm sad to be here rather than there in the freezing cold. If you go to South by Southwest, you'll see that the amount of venture capital that is being deployed in digital health is basically driving venture. It's actually comparable to, if not greater than, the traditional VC investments, which are in biotechnology, development of new treatments for disease, new therapies. There's enormous investment in venture capital in digital health. And if you talk to those digital health companies, where they're finding the utility and the uptake and the consumer is with that consumer piece. Why? Because you can test it, right? If you think about an insurance company. If an insurance company wants to roll out blockchain technology, it's very hard to pilot because they have to pilot in, say, a risk pool of, say, 100,000 patients or covered lives. It's very hard to do that because if you mess up and it doesn't work, the insurance company gets sued, maybe they violate the law, they lose lots of money. There are all sorts of risks for insurers, and there aren't enough rewards relative to the risks. But for that consumer who's controlling the dollars themselves, and you can test that product among 5 people, 10 people, 15 people, and then it grows and grows and grows. So that's where you're seeing a lot of the interest and certainly a lot of the investment.
But the other thing related to consumer-driven innovation is the Internet of Things, because as you have Avix Fitbit and all of the other wellness devices that people are walking around with and recording their information and tracking their their health records. One of the things we like to joke about is that a patient's electronic health record today is mostly their sick record, right? It's their sickness information. But with this incredible tsunami of IoT data that's going to fill the system that's not analyzed at this point, it's going to drive consumer innovation.
Well,
and-
but it's not really
company that-
healthcare. I mean, it's wellness. Which
Well,
is
it gives
still
a-
healthcare.
It's well, if you
That's the right way.
that's right. I
And
mean,
the
if you
Fitbit
Right,
goes
but
in
it's
the
only
drawer
part of
after
the
6
whole-
months.
What's
so
that? Yeah.
Those Fitbits are going in the drawer after 6 months.
but there's all
What
kinds of other
we-
IoT data that's going to feed into the system.
What's happening with that data and the reason why it's not being used, and as a platform that powers a lot of the digital health companies that you're talking about, to allow them to get to viable solutions at scale, because we do get them connection to patients and patient records. We get them connections to insurance companies and all their benefit information. We also connect that IoT data to value. And unless you're connecting it to value, nobody cares, which is why you only wear it for so often and put it in the drawer. So I would say because we're actually powering over 1,000 applications, we know which ones are actually succeeding and which ones aren't. So I can tell you that the ones that are succeeding are the ones who are actually selling into the providers as far as payments go. It's not being demanded by the consumers. I know that's anti-intuitive, but that's the truth. It's being demanded by the providers because they're seeing people show up with high deductible plans, but they still have a fee-for-service practice management system, or EHR, which allows them to take that patient, treat them, send them on their way, and not find out for 14 to 120 days, because that's the average accounts receivable for a provider, that person needs to pay the bill. So then they're trying to bill them, and 20% of what used to be reimbursement income is now going to collections. That's what's driving.
So the
This-
biggest thing is you're not really healthcare, they're billing.
And it's not the consumer. Someday it may be.
Well, but no,
Yeah.
but I think among right now, most of the healthcare system is not consumer driven. So
Correct.
law of large numbers, a small percentage of that large piece that's driven by insurance and
It's the
third-party payment
unintended
providers.
consequences of high deductible plans that's driving it.
So,
Yeah.
so I wonder if there's not really a financial benefit tied to the consumer data. And certainly there are efforts when you look past healthcare, but look more in health. You may see more involvement. I'm involved, I co-chair in a work group called the HEART, which is we're looking at protocols around OpenID Connect, OAuth, and open on user managed access that looks at not just healthcare, but health data and big data about how it combines together for a consumer-mediated exchange. And I think until there is a value add that a consumer understands, or the value of the power of owning their own data and what they can benefit from, I think some of that will help drive. I do believe what's driving the consumer development is because there is less regulation around it. So it's easier more for their smaller startups to start with that, because they don't have to go through all the things that you had to go just to get approved to work with providers and things like that. So I think it's more complicated than as you deal with it, look at it.
But to pull it back to blockchain, because I know that's why we're here. When you think about all of the stakeholders that can assist in a patient's episode of care, from the telehealth organization that is a third party to the health system where they may initiate their encounter, who needs to hand off information to a health system if they need to refer them in, or to a pharmacy, to ultimately the nursing facility that person may end up at after a procedure, or the bank that may offer the payment plan, or the life insurance company that would now like to sell you life insurance if you're having a child, and they can detect that and target that. That is, yeah, they can detect. These are the sorts of use cases that the large health insurers, providers, banks, technology companies that are in the DocChain Alliance are telling us they want.
That sounds kind of something as a patient I might not be that crazy about.
If you can't control it, you're right. And if you imagine the way it is today, where you have no transparency into it, you can't see what's happening, you can't see the handoff, you don't get to give permission, it's just done to you. Where if you are giving permission for the data sharing all along the
But
way,
if the
then
life
it's
insurance
convenience.
company comes to me and asks me if I'm interested in getting this insurance, because I know
If it's
they
an-
came to me because
If
they
it's
could
an
tell that I have
ad,
a
yeah,
need.
if it's a relevant ad, the crazy thing is it's
already happening.
Yeah, it's already happening, and relevant ads, particularly for women, 45% click-through rate on a relevant ad associated with health. Yeah, it's convenient if it's meaningful to me. So yes.
Is there anybody among you who has seen blockchain in action in healthcare, like either in a clinical setting, if you will? I mean, like I know that there's been this experiment up at Deaconess in
Beth Israel. Yeah.
Beth Israel in Boston and maybe in other places. Are there anything we've learned from these?
We focus on the business transactions of healthcare because, frankly, nobody else was. And in that idea of connecting IoT and other things to value, you have to have those business pipes. So what we've had running on the blockchain for over a year are clearinghouse transactions and being able to have a multi-sig wallet to allow consumers to authorize the sharing of data, to approve their benefits, validate their benefits, and submit a payment across multi-parties. So we've had that running for over a year. And that's with a Cigna and between a real provider. That's not just in a test environment.
So the interesting around MedRec, and they actually presented at the workshop last September, was yes, they leverage blockchain, but they were flexible enough to be open to what type of blockchain that they would use. So the idea that there are applications out there that may be able to leverage different flavors, and I think that it would be interesting to see where efforts like that evolve from there.
And there's
We talked about that
there's
earlier.
Estonia too.
Yeah. And there's Estonia.
So Estonia has released a national health record based on blockchain.
They were one of the
really?
first.
Yeah.
They were
they
the
were.
first.
And there, that's a really good example because it's kind of a smaller, more controlled population, but they're pulling people in and saying, the patient's back in control. So patient-centric thinking in healthcare sounds kind of like, oh, why isn't it that way? Well, that's relatively new thinking here in the US, but Estonia said we're going to do it at a national level and invite people to use it. I don't know a lot about the solution. We haven't done a lot in the US yet with blockchain, so these are good examples, initial examples. I go back to, I think identity is going to be a big one. It's going to start with that. That's what Microsoft is working on, and we see it with others. I do want to comment overall on what we're all talking about, though. We're all healthcare consumers, and what really drives us, what we all want to do, is feel better. We want to heal. We want to be healthy. We don't want to manage a consumer-driven health plan or high deductibles or know what our deductible is. And those problems exist. And I think what the blockchain does, it gives us the opportunity to now pull all that data together to make those interactions much easier so that we can feel better. And doctors, we had a doctor say to us, we're doing this with your technology now. And what was really cool about it at the end of the day was he saw more patients and got to go home on time. That's really what people want to do. And so we have to think about it that way. Why is this better for the patient? Why is it better for the provider? Why is it going to reduce the cost of population health and enable population health programs? And when we start to think about it that way, this technology will make a lot of sense. It's going to disrupt the traditional EMR vendors, the disease records, because that's what they are. It's that second wave of the internet. It's going to be very disruptive, but that's why for me, this initial Codathon and this meeting was so relevant to seeing what the possible starts to look like.
Well, how do you see it disrupting, let's take the EHR sort of systems. Is there going to be an Epic version of blockchain?
Epic better have a version on blockchain, or Epic's going to...
Or are they just a node?
They will be a node. They'll be a contributor to that data stream, but the distributed ledger concept does not exist in EMRs. The only time your EMR is actually relevant, and this is going to scare everybody, is when you're in the hospital. When you're home, guess what you don't have? An EMR. And
Because you don't own it.
because you don't own it.
that's
Exactly.
the
And
key
you
problem.
are the data. So when a hospital says to you, we own your data, no, they don't. They own a temporal view of your
Well, in
data.
California, they do.
Yeah.
And
so
there's,
is-
and
but
there's
so is-
not going to be a wholesale disruption of the EMR system.
gonna-
They're just going to
exactly,
be
it's-
another feed, a data feed into the
they're just
blockchain,
gonna be a
just
feed.
like
It's in
every
the-
other
Well,
data.
but
It's a
here's
note
the
on
thing.
it.
If the meaningful use phase 3 actually gets implemented, and there actually is interoperability with patient health records, that will start to disrupt. Epic, for those of you who don't know, Epic is a,
Blockchain makes that unnecessary. I mean, that's kind of the point.
Well, that's
Yeah, I mean, it could save you that legislation right now.
Oh, I'm not saying it. No, it's
Yeah, just
the
like,
legislation.
save some
just bring
money.
blockchain
Don't do it.
into the
Yeah.
law. Yeah.
It's like, don't do it.
Bravo.
Absolutely right. But we will. For those who don't know, Epic is the healthcare IT company that has dominant market share and has a closed system that a lot of hospitals use to
it's
basically.
not really any more closed than anyone else's, I don't think. But anyway,
Well, we can debate it
But
that
everybody
later in a
thinks
different
it is.
panel.
That's a different panel.
But the blockchain can play absolutely a significant
Yeah.
role in transforming that market.
And it's what Lisa said. All of these providers become nodes. They become off-chain nodes that are providing data, and they're also consuming it, so it makes them better too. Now we do need to get the Epics and all of those. It's not just Epic, it's Cerner and Allscripts and all those guys. We need to get them to see that too, because those are billion-dollar companies that are also competing for our dollars.
And they're seeing the landscape changing.
They
and
are
they're
seeing
and
it.
they're struggling,
They-
just
yep.
like everybody else, in how to cope with this massive
it's-
onslaught of data that's just coming and coming and coming.
Yep.
but so this is an area where the rules, the regulations that we have in place could actually help this along at this moment anyway, even though we didn't like
What
meaningful
do you
use.
mean?
I mean, that if we continue with meaningful use to stage 3 and we have open APIs as required and so on, that makes this easier, right? It makes
Well-
blockchain,
I mean, yes and
Another-
no. I mean, most of those efforts are already underway. They're not necessarily cooperative. You have Epic has Sequoia. You have all the other EMRs have Commonwealth. They have APIs to an extent, but we have to accept that they were never architected to be interoperable. We do have to accept that all the APIs in the world won't really help that. It will allow them to feed necessary data to a connected network. I mean, today's architectures, today's technologies are inherently interoperable. I do think it is useful for Congress to require interoperability, but not say the how. I mean, we are where we are today because too much how was legislated. So let's not do that. But the must, absolutely. And how we do it, blockchain is a way to do it. I'm not even limiting us to that. But certainly the best next option on the table.
So what is to do it? Is it to the best way to aggregate data across many different sites? When you talk about standardization, there's certainly in healthcare, there's standardization around terminology. That's not going to go away whether blockchain is implemented or not. So I think what is that underlying power of blockchain that's going to affect these different EMR systems and make the difference? It's
Shifting the center of
unclear
gravity.
for me on how that would shift.
I think one of the things we have to be careful about also, we're talking just about data interoperability. The blockchain provides you with interoperability, period. It's identity, it's data, it's process, it's location and devices, and what interoperability really is. And we focus way too much on the data and the standards. To Lisa's point, I was at a Weedy SNP conference a few years ago, and someone said we need more standards. No, we don't. We need more openness, and we really need to define what interoperability really means
We
and
need
how it's
viable
gonna be
business
most effective.
models.
Exactly.
Yeah.
Yep.
I mean, business models today were designed to not be interoperable.
Yeah.
They make a lot of money not being interoperable.
Yes, they do.
And they make a
privacy
lot of
has
money
always
on
trumped
inefficiency.
interoperability.
And writing
And that's
interfaces.
what
Yeah.
slows the adoption of blockchain as a technology, is that there's more money to be made in closed systems.
Right.
Well, I would argue there's not more money to be made.
In the future.
Yeah, in
the
fact,
future,
there's so much
historically
new
is what I mean.
value to be created and money to be made. That's why you're seeing banks and life insurance companies and others show up in the alliances. They're like, we now have a way in. We
Yeah,
can
one
start
of the
offering
things-
But the
products.
One of the
data
things-
that's used to support your health is growing exponentially, right? You use your weather data, you use other things that's not traditionally based on location data or whatever, that's not based on health information. So I think for that, you're going to need the technology is going to emerge to be able to pull, as you say, this massive amount of data that you've never had the ability to deal with before.
And
I
going
think
back
that'll
to
grow with
Lisa's
it.
very important point, it's just going to be, the future is not going to be a closed system future. The economy is leading the way. The marketplace is speaking to us. And so it's going to be what we like to call a collaborative economy, where like-minded people, like-minded organizations are working together in a trusted ecosystem, a trusted data ecosystem, which is fueled by things like blockchain, in order to get what one could call collective intelligence from multiple data sources. And that collective intelligence is going to be the new wealth. And data is the new commodity of
And
that
is
wealth.
value-based care sort of the healthcare version of this? And do we believe that that'll be transformative in that it's the government and private insurers saying we want to buy the health of this patient rather than this procedure? I mean, is that?
Well, it's gradually moving in that direction towards being more about value versus quote unquote fee-for-service medicine, as you hear the buzzword. And as the cost of healthcare keeps going up, that pressure increases. But the biggest barrier, I will reiterate again, the biggest barrier to more rapid adoption of those approaches has been the fact that historically people have relied on third-party payment of healthcare services to get their healthcare, which is like a ninth-party system, which is going to be very, very divorced from the value and the quality of and the price of the care that's delivered. So the more we can shrink that, so that the consumer is more in control of their dollars, and of course, we can subsidize it for the people who need the help or vulnerable populations. But the more consumers are in control of those dollars, the more they're going to demand and drive adoption indirectly or directly. It's not necessarily going to be like, oh yeah, I want a blockchain-based electronic health record, whatever it is, but the value that is derived from a blockchain-oriented approach or built approach is going to filter down to them, because competitive markets in which you choose a health insurance plan that's saving money because it's managing your care more efficiently because there's much more inherent interoperability. If you have a heart disease and diabetes,
I got to interrupt you because please take this the right way. I hope everyone knows that consumers having more control of their dollars is the same as consumers paying more.
well, no,
Okay.
well, not necessarily. No, that's absolutely not true.
It is
That
absolutely true. As a member of a high deductible
No,
plan.
that is absolutely not true. Right now, the government spends more than $1 trillion
In
a year
Medicare,
subsidizing
yes.
healthcare for people. If you give people those dollars and let them control them in things like subsidized health savings accounts, they're controlling the dollars, but their financial exposure can be the same. So the whole point here is to have them control more of the dollars. You absolutely can do this. We do this in every other sector of the economy. When people have food stamps, they have EBT cards, they shop for their own food. We don't have government farms and government grocers that they're required to go to buy their groceries.
So
we can do that in
I think
healthcare too.
what happens though, it's about changing behavior and
Sure.
using everything we're talking about to change behavior. If you have a capitated payment, which is what we're talking about, you have a limited number of dollars. It's a constrained model. Everything is. Consumers will hopefully make better choices, because I agree, I'm spending more on my health care now, but because it's in my health savings account,
Well,
I'm looking for these doctors and being better at shopping for it, making sure that I've got my medical data, that I'm prepared.
And
I think we're kind of devolving into a
It's a
generalized.
panacea.
I think we're devolving into a generalized fist fight over healthcare reform, which if everybody wants to get up,
That's
we can-
another
we
panel.
can
That's
get
panel
going,
number
which is cool. But maybe I should. I'm sure members of the
Bring it
audience
home,
have
Arthur.
better questions than I do, or additional questions. So I'm going to call on some members of the audience to ask some questions.
Thanks. So there's been a lot of focus on these big issues, a lot of focus on, oh, by the way, Scott Whitby with the Identity and Payments Association. Thanks. I got a big enough voice, though. You know, when you're talking about blockchain, you're talking about, you've spent 80–90% of your time talking about electronic health records, which is perhaps the most difficult nut to crack because of the deeply rooted intermediaries, third parties. They're going to make this really difficult. Absolutely the best use case to fix, but also the most difficult because of that. Can you take a moment and talk about all of the other opportunities, and claims processing was one, and identities at the heart of it. I'm working with a large healthcare group up in Pennsylvania on creating a proof of concept, talking with Jem and some others, about different use cases. And there are so many where you're talking about that secure transactional layer. We're almost talking about, you know, HTTPS in the early days of the internet.
Yeah,
There's so many opportunities for using the blockchain for those other purposes. Can you talk a bit about that and get out of health records for a little while?
No kidding. Yeah, you can die there. So, oh yeah, you can.
A lot of people have.
Yeah. So provenance auditing supply chain is such an obvious one. And when you think about who's entering supplies and supply chain in a big way in healthcare, another Northwest company, Amazon, they're starting to sell supplies, medical supplies and durable goods direct. In the first year of operation, over $1 billion in revenue. I mean, this is a company that is definitely going to be looking for operational efficiency, not making money off of operational inefficiency as we do today, primarily in healthcare. So my bet is on supply chain very much as a next use case, and simple auditing. And when and I think you're right, Chitra, in that if networks are started in perhaps just a large health insurers in-network physicians, and thinking about operational efficiencies, auditing of transactions, all of those physicians and practices and health systems auditing their transactions and the assistance that would give them on a yearly basis, not just with their private payers, but also with the government. Huge use case that has immediate benefit.
And I would add to that, I would say that applies to any supply chain. So pharmaceutical manufacturing and deliveries, just tracking those. Also medication management and adherence in hospitals with things like diversion, where the medications are actually stolen by the caregivers and things like that. You're going to see that this type of technology be applied at those levels to really be better at controlling the flow of that supply, regardless of what you're supplying.
And one of the most fascinating use cases that we've starting to develop quite a bit of expertise in is the GDPR issues in European countries now, the right to forget laws and how businesses must comply with those laws. And essentially, it comes right back to the notion of identity. You know, that the data is controlled by the owner of that data, and they have the right to decide where that data flows and whether that data can be destroyed or whether that data can be changed. And so helping these Forbes 2000 companies or Fortune 2000 companies or Fortune 500 companies deal with these kinds of issues, I think is where blockchain could actually really help, because of that nature of the identity creation and controlling data by attaching it to an identity.
So in auditing provenance and possibly even other value metadata is something that could, in the short term, improve healthcare now. So it could be a easy win or a low-hanging fruit or whatever you want to say that could help introduce blockchain more quickly into the environment.
Okay, well, I think we have time for one more very quick question.
Hi, I'm Jamie Clark. I'm a standards guy from Oasis. Debbie, big fan. How do we keep what happened in HIPAA from happening again? We landed a bunch of requirements on people. They sounded great. Everybody was going to save money, but nobody could do them. So we had a giant wave of intermediaries and clearinghouses, and now, everybody's still speaking 14th century cuneiform, but then there's another layer of providers doing the cool stuff.
Yeah.
That would not save money. Can we keep that from happening with these new technologies?
Well, I think that, the thing about HIPAA that's so ironic is HIPAA was passed in 1996 at basically the tail end of the industrial age and the dawn of the internet age as we know it. And so it was almost perfectly timed not to be adaptable.
Timing was horrible.
To the world we live in today. And so the longer it takes for Congress to try to mess things up again in this regard, the better, because that new technologies can be adopted and therefore be accounted for. And particularly when it comes to the way Congress works, if there are profitable businesses that can then lobby their congressmen and say, hey, don't blow up our business model here, that actually makes a big difference in the way Congress thinks about things. Otherwise, it's incumbents who have much more pull, and that becomes a challenge. So I think, broadly speaking, if Congress stays out of this area and lets it just sort of develop organically, the better. But again, I will repeat, sound like a broken record, the more consumers are in charge of the dollars, the more that will drive adoption.
Guys, in this area, do you think DLT can be self-help? Can this bring, methods to, all the way down, not just to a bunch of service providers in the middle?
Anyone want to take that on?
I didn't hear the very
What was
first
the-
part.
Say that again?
Will blockchain technologies do something for people at the end of transactions, the payers, the providers, the patients, as opposed to mostly be managed by intermediaries at another layer of expense?
Well, I think that's what we've been talking about.
Yeah, that's so. For example, that autonomous auto adjudication of claims. I will tell you that one of the largest payers in the country and one of the largest health systems in the country stood up and laid down together, lions and lambs, a natural act, said, we will work on that together. Because that will be better for each of us and it will be better for the patient.
That was my first thought when I looked at blockchain, was that it was going to disrupt the clearinghouses, the intermediaries. And I do think that is a big area of opportunity, but I agree with you, having worked on a lot of HIPAA 4010 technical implementations, it was a repetitive, costly exercise for every individual organization, but that was the challenge. Everybody did their own version. They all told me, oh, we're unique. No, you're not. You're a health plan or a hospital, and you all have to do it in a very similar fashion. So it goes back to...
I do have to add on to that. We are a clearinghouse. We fully intend to disintermediate ourselves.
Yeah.
Absolutely.
You have to think that way.
Yeah.
Thank
All
you.
right, well, you're
Yeah.
I'm
Sounds
sure
like smart
everybody here
podcast.
is available for
Here, I have a party.
pursuit.
Thank you.
Pursuit after
I don't have one.
panel.
for you. Oh, we can
Thanks,
have it.
everyone. Thank you, Chitra.
Chitra.
Thank you, Avik,
Thank you
And,
very much,
Lisa.
Arthur.
Hector, and Debbie. Thank you.
I want to also thank the sponsors of our healthcare panel, GEM, Microsoft, and PocketDot. And I also want to give a big thank you to our summit partner, Politico Pro, who's our official local DC media partner in this event today. And there are copies of Politico in the lobby for all of you, and it will be delivered in the morning as well.